My name is Luke Bagg, and my partner is Paige Salas, and we chose to do our psychology and film assignment over the Joker in Dark Knight. The Joker, specifically in this movie, is a criminal that's been disfigured and driven insane by things in his past. He's portrayed as a homicidal psychopath, and as Batman's rival. Lives in Gotham, which is a city full of crime and corruption, and relies on Batman to save the day. The Joker's condition is easily recognizable due to comparing him to the other people in the movie. We chose to classify his disorder as psychopathy. If he were to visit a therapist, it would most likely be antisocial personality disorder, which can include lack of empathy, impulsivity, pathological lying, and inability to establish relationships. This cannot be cured and can last for multiple years or an individual's lifetime. Psychopathy is recognized in all cultures due to the severity of the condition and what it takes to treat these patients. Stigmas in our culture about psychopaths are that they are out of control and are murderers. This more or less aligns with the Joker in the film. He does murder people, but not all psychopaths do. So, one symptom evident that we found is his tendency to be a pathological liar. The timestamps of 30 minutes and 18 seconds and 51 minutes. He tells two completely different stories about how he got his scars. One focused on his drunk, abusive father, and the other on a past relationship of a woman that he was being supportive of, and it wasn't reciprocated. Shows that he cannot tell the truth and may not even recognize what truth is. Another symptom is his lack of empathy towards innocent people. Batman says that he had killed 5 people, and the Joker simply brushes it off as if it were nothing. One missing symptom that we found was the habit of having multiple romantic relationships. This is due to his inability to stay loyal and feel as though he gains anything from that relationship. He's more portrayed as a lone soldier. Some treatment options we found. Psychotherapy would be useful in attempting to suppress some of those twisted, dangerous thoughts that are potentially harmful to the patient or to others. Educating them about what is causing this can possibly help control those thoughts, feelings, actions. Another way is behavioral skills training, which can be used to show the patient new ways to cope and come up with physical ways and teaching points to relieve the stress of having that disorder. Another one is isolation, which is used to kind of literally keep them alone in a cage or jail cell kind of thing. It's very dehumanizing, but it would be very beneficial in a case like the Joker's because of the severity of it. And broader perspectives, the Joker is a very, very extreme version of a psychopath. This is kind of what people think of when you say the word psychopath. They usually have environmental factors or in early age that induce brain trauma, which is kind of boils and builds up, which can cause psychopathy. The way that it's portrayed in the movie differs from the way that it actually is like carried out in real life, though there are some similarities. The Dark Knight provides an interesting perspective on how to look at psychopathy through the characterization of the Joker. Furthermore, the movie displays an example of how psychopathy can be viewed on an extreme level. Although the movie provides symptoms of psychopathy and how these symptoms may affect other individuals, does not entail a blanket diagnosis for all psychopathic patients. And there are sources. Thank you.